I really respect and value conventional medicine. I have many good friends and peers who we work collaboratively together, and that's when health is at its best because we have the, I would say, luxury and privilege of spending more time with our patients. So we can really get deep with our preventative lifestyle coaching medicine. And that is medicine. You
Hmm.
don't change a diet overnight. You don't get somebody who's never exercised to suddenly exercise every day just overnight. That takes trust and
Hmm.
coaching and massaging and tweaking. Naturopathic medicine, our oath is, our first line is actually doctor as teacher. That is our primary objective. I am not doing my job if I have a patient who still needs to see me every week after 6 months. My job is to empower, inspire, educate, and so people can start to become their own detectives. So I'm not going to bash people who want to go on Google because that means they're curious. That means they're questioning convention.
Yeah.
But we're looking at it from a place of how do we distill the information so that it's right for you. And we're
Right.
also mandated to do no harm. So we're more likely to use diet and nutrition and lifestyle modification and counseling and safe nutritional supplements and herbal medicine, if applied correctly,
Hmm.
to lean the body
Hmm.
towards homeostasis, to nurture the body towards self-healing, because we believe that there is innate ability for every person to heal themselves if they're taking in the right foods, if their bodies are detoxifying properly, they're eliminating toxins, and you have the ability to self-care in the right way to replenish your tank. These are like the pillars of health that
Yeah.
I see. And disease just doesn't happen for fun. Disease, 100% of chronic disease comes over time from some systems in your body that are not working the way they're supposed to or not communicating the way they're supposed to. And we want to integrate we want to
Hmm.
look holistically. As I said, I don't just treat a uterus, I treat a whole woman, I treat a whole human. And so we know that 90% of chronic disease has some degree of a stress element in there. And so we wouldn't be doing our
Hmm.
job if we didn't look at that as
Hmm.
well. So that in a nutshell is what we do. We're really good at functional medicine. We're really good at detectives, being detectives, saying, okay, you have eczema and you have insomnia and you have terrible menstrual pain. How is that all connected? It is. So we look at finding the root of
Wow.
the problem. When you treat the root, there's less to do. We're not just trying to band-aid. And the
Yeah.
way I describe it is, say you have a bucket and you're constantly trying to fill up that bucket that's getting empty all the time, but you're forgetting or you're missing the fact that you've got holes in that bucket. So instead of constantly trying to fill,
Mm.
let's plug the holes.